All right, let's talk about determining the vector of ventricular depolarization, aka the heart axis on an ECG. First, let's take a look at the leads of the ECG, and we're going to focus on these blue ones, which are the limb leads. And the limb leads are given an angle where lead 1 is angled at 0 degrees from the heart. That's just a convention. AVL is at minus 30, 2 is at 60, AVF is at 90, 120, and AVR is minus 150. AVR is kind of a loner lead that mirrors all the other limb leads. Now, what you should realize about the left ventricle and the right ventricle and myocardium in general is that the direction of depolarization goes from inside to outside, from subendocardially to subepicardially. So this direction. And what you should also know is that the left ventricle is way stronger than the right ventricle. So if the forces of left ventricular and right ventricular depolarization are simultaneous, then we will have simultaneous forces this way, and these forces, since they are stronger, there will be a net direction of electricity in this direction. And that's why normally the vector of left ventricular depolarization is somewhere between minus 30 and plus 90. Now, there are two ways to quickly determine if the heart axis is normal. One is to take a look at leads 1 and 2 on an ECG, and if the QRS complexes in both these leads are net positive, then there is an intermediate axis of ventricular depolarization that is between minus 30 and plus 90. Now in this case we see that lead 1 is positive, but lead 2 is negative. So we already know that the heart axis is not intermediate. Looking at a more left-sided axis like AVL, we see that it's positive. Looking at a more right-sided axis, such as lead 2, we see that it's more negative. So we know that the heart axis is left deviated. It's less than minus 30. It's somewhere here. So this is method 1, which is a quick method. Take a look at leads 1 and 2. If the QRS complexes are net positive in both these leads, then there is an intermediate axis of ventricular depolarization. Now then there is another method which is more insightful, which is to take a look at which of these limb leads is most isoelectric, and then the angle of ventricular depolarization vector is perpendicular to that isoelectric lead, which may sound cryptical, but it's easier than you may think. Let's take a look at these limb leads and determine which one is isoelectric. And with isoelectric, bear in mind, I don't mean that the deflections are as close to the baseline as possible. I mean that the positive parts of the deflection cancel out the negative parts of the deflection. So an isoelectric lead may look like this, the QRS complex. So it may look like this, or it may look like this, as long as positive and negative somewhat cancel each other out. Now in this case, in this ECG, it seems like AVR is the isoelectric lead. Now as we said, AVR has an angle of minus 150 degrees, taking lead 1 as 0 degrees. So the net vector of ventricular depolarization is perpendicular to lead AVR, so perpendicular to minus 150. Now minus 150 plus 90 degrees is minus 60, and minus 150 minus 90 degrees is minus 240, or plus 120. So the heart axis is either plus 120 or minus 60. Now, since we already see in the ECG that AVL and 1 are positive and AVF and 2 are negative, we know that this is a left axis deviation. We already know that, and we know that the exact vector of ventricular depolarization, the exact angle of that vector, is minus 60. So there's a left axis deviation. I hope you found this video insightful. Please do like, share, and subscribe to my channel.